best person to prevent kidney disease or to stop deterioration of the kidney is not a doctor, it is not a nurse, it is you, the individual, who will be in charge of preventing kidney disease or preventing the kidney from further damage to that stage where it can no longer sustain life. Hello viewers, our topic for today is kidney failure. I will begin with this. I urge you to go and check the state of your kidney. If you are watching me at this very moment, I will encourage you to go and check the state of your kidney. You don't have to wait and be told you have kidney failure to know the state of your kidney. All of us are at risk of developing kidney failure or renal failure. You will ask, why do I advise that you go and check the state of your kidney? You see, every time there is so much conversation about kidney failure, but this is the thing. There are 5 stages in kidney disease. The last stage, the 5th stage, is what we call end-stage kidney disease. And another name for end-stage kidney disease is kidney failure. So this is the thing. The kidney does not fail within a short possible time. It is not a sudden thing. Getting to the last stage, which is the kidney failure, does not happen suddenly. It takes a long time before that state is reached. Of course, we have certain conditions that can shut the kidney down at once, that can cause the kidney to fail at once, and this is what we call acute kidney failure. But the normal problem that we have about kidney disease is the chronic type, kidney failure as a result of chronic kidney disease. And this is the tricky thing about kidney disease. I mentioned that there are 5 stages. The first stage, the second and the third stages, when somebody is experiencing kidney disease or is having kidney disease, the person does not exhibit any signs and symptoms. There are no clear signs and symptoms associated with the first 3 stages of kidney disease. When the kidney is deteriorating, it does so in gradual process. The first 3 stages does not have any clear signs and symptoms associated with it. The danger is that signs and symptoms of kidney disease only show up when damage to the kidney has reached an advanced stage and it is almost irreversible. It is irreversible, and that is the later part of stage 3, and then stage 4. So this is what makes kidney disease very tricky and dangerous. So when people are talking about kidney failure all the time, sometimes I wonder why they don't really mention the fact that we have kidney disease which deteriorates or which gets worse with time, and it is in stages. And I would like to mention that kidney failure is just like to die. See, when somebody is having kidney failure or the person got to end-stage kidney disease, it's like the kidney is dead. So why will you have to wait for somebody to die to be running around him or her when you have the chance to prevent the death in the first place? So you don't have to wait to be diagnosed of end-stage kidney disease to know that there is something wrong with your kidney, because at that time it might be too late. It might be too late. There is nothing that can reverse a damaged kidney where its core function, its main function, elimination of chemical waste, is lost. There is nothing that can reverse when that stage of chronic kidney disease is reached. The only solution is kidney transplant. But we will ask ourselves, how many people have the resources and the money to do kidney transplant? So I will not waste time talking too much. I will urge you that go and do kidney test. In stage 1, the deterioration of the kidney is limited, is minimal. So the core function, which is elimination of chemical waste, is only affected slightly. So that will be, let me say, around 90%. Ability of the kidney to perform its core function, elimination of chemical waste, around 90% in stage 1. There is no way you will know. There are no signs and symptoms associated with stage 1 kidney disease. In stage 2, the deterioration goes further. So there is a mild injury or damage to the kidney, and its core function, which is elimination of chemical waste, is reduced down to, let me say, 70%. At that second stage, like I said, there are no clear signs and symptoms associated with it. When nothing is done for a long time, it moves to the third stage, where the performance of the kidney, its key function, elimination of chemical waste. I am stressing on elimination of chemical waste because when these chemical wastes are not filtered, eliminated out of the body, it is very, very dangerous. It affects all parts of the body. So when you see somebody suffering from kidney disease, the person is exposed to all kinds of serious signs and symptoms. So in a stage 3-2, there is moderate damage to the kidney. The core function is reduced to, let me say, 50%. And over there too, there are no clear clinical signs and symptoms to the individual that there is a problem with the kidney. The only time you can get to know in the first 3 stages is when you do lab investigation, which will indicate that indeed the value of the kidney's function has reduced or deteriorated. That's the only time you will get to know through laboratory investigation. And then when nothing is done about it, it descends to stage 4. And a stage 4 kidney disease is called chronic kidney disease. At that stage, the disease has become something like it's going to stay with the person. And when something is chronic, it doesn't go suddenly. There's no way you can, undo what is chronic. And at that stage, there is significant, severe damage to the kidney, where it can no longer perform its key function, elimination of what chemical waste out of the body. And once the kidney cannot eliminate the waste chemicals out of the body, they are going to accumulate and begin to cause serious harm. That's when the person begins to experience very serious signs and symptoms, difficulty in breathing, easily feel tired, the body is loaded with fluid, So at this stage, it can only be managed with dialysis. And as you hear often, the cost of dialysis is very high. And when you get to that stage where you need dialysis to perform the function of the kidney, which is eliminating the chemical waste, you will have to continue doing that till to the end of your life. And I don't think many of us have that money to sustain our life on such dialysis machine. And when it gets to an advanced stage, in the 4th stage, chronic kidney stage advanced, it gets to the kidney failure, where the function of the kidney will reduce to 15% or less than 15%, where it can no longer perform its function. And that is when the person's life begins to go gradually. So this is the reality about kidney failure. So kidney failure that we hear about, it is not something that happens suddenly. Kidney failure is called end-stage kidney disease or stage 5 kidney disease. It is a type of kidney disease that has deteriorated. So let's focus on stage 1 kidney disease. Let's focus on stage 2 kidney disease, where we can do something about it to slow down the deterioration or the breakdown or the damage to the kidney. But all the time we are so sensational about kidney failure. Somebody is dead, the person is already dead. There's nothing you can do about it, but only to help the person to a very peaceful end. That is death. That is what it is when we are talking about kidney failure. So I will urge the media, as much as they want to bring to the forefront issues around this health problem, I will urge the media to make frantic effort to educate the public on the stages of kidney disease, of which the kidney failure is the last one end-stage kidney disease so that people can be in charge of preventing this horrible disease. You see, nobody can prevent kidney disease except you, the general public. The best person to prevent kidney disease or to stop deterioration of the kidney is not a doctor, it is not a nurse, it is you, the individual, who will be in charge of preventing kidney disease or preventing the kidney from further damage to that stage where it can no longer sustain life. You are the best person. Why am I saying this? The factors that lead to kidney disease, a lot of them are from other chronic diseases. A typical one is hypertension. Hypertension is a disease, as it is often called, the silent killer. I have never seen anybody with chronic kidney disease who has not developed hypertension or chronic hypertension. So if you want to prevent kidney failure and you have hypertension, please take the management of it very seriously. Manage your hypertension very well, because if you don't, it will definitely lead to kidney failure. And prevention of hypertension, proper management of hypertension, again, is not done by the doctor, it's not done by the nurse. It is done by you, the individual. Proper management of hypertension. And kidney disease has a lot to do with lifestyle, and hypertension is a lifestyle disease. Lifestyle, the food you eat. You see, most of the time, we often say, oh, we won't see and that. So people eat things that they are not supposed to eat. A lot of people, spend most of their life eating meat. They want to have fun. They eat junk food. They eat fatty food, and they don't really, intentionally try to eat food that will help maintain good health. All of these things play a role in developing some of these life-changing disease conditions. And again, to discipline yourself and eat healthy, it must be done by you. That is why I said the prevention and proper management of kidney disease is not done in the hospital, it is done at home. So you have to watch the kind of food you eat. You have to watch the kind of food you eat, because it greatly affects health. You see, we have adopted so much of the Western lifestyle, the kind of food they eat. But one thing that I want us to notice is that, or to acknowledge and understand, is that people in America, they have the money. USA, the developed world, they have the resources to help the maintenance of health of their citizens. They have the resources for the best kind of health care. So you see them, they eat anyhow, they put on weight and all of these things, but they live long because they have the resources, they have the money. And when you go to some countries, dialysis is free. All right, dialysis is free. They even have the money, but they focus on preventive healthcare. Primary healthcare is a big thing in most of these developed countries. So their citizens live very long, even though we say they eat junk food. But we are adopting those sort of lifestyle, eating of food that are not healthy for our body. We adopt KFC is everywhere. I'm not saying don't eat, but some people eat just this kind of junk food almost all the time. Here in Ghana, we don't have the resources, we don't have the money to manage some of these expensive diseases. So that is the danger. So let us make conscious effort to take care of our health through our lifestyle. Let's modify our lifestyle so that it will reflect in our health. You see, medicine that you see is chemical. When you take in medicine, no matter how small it is chemical. When it gets into the body, it is not the best thing for the body, but it is meant to work on a certain malfunction or health problem in the body, all right? But the kidney must work to eliminate it. So if you are that type of person who like to take in painkillers, there are some people who sleep on painkillers. Without painkiller, they will never sleep. When you continue to do that, you are putting your kidney at risk, because the chemical constituents of the medicine, the chemical potency of the medicine must be dealt with by the kidney. And as you continue to take in more of these drugs, you will get to a point the kidney will be challenged. And that is when the deterioration will set in. So let us get this clear understanding on kidney failure, that kidney does not fail suddenly. It is not an infection. It is not an infection like malaria or cholera, where it happens suddenly, it happens over time. The meaning and the real name for kidney failure is chronic kidney disease in stage 5 or kidney disease in the end stage. That is end stage kidney disease. That is how it is diagnosed in a hospital. So thank you very much for your attention. If you have any question, kindly feel free to ask in the comment section and I'll get back to you with an answer as much as I can. Thank you very much for your precious time. Until then, look forward for the next presentation.
Thank you.
Subscribe and follow us.